I believe so. In 2015, when we carried out a survey of nurses, as I said, there was 47% that said they were washing below 60. This was of the 250 odd respondents. There was a higher ratio of people washing with other items in the wash. So when we repeated that survey during the pandemic, there was a much higher percentage of people following the guidelines. However, a large percent of the nurses would have preferred industrial washing. They were much more aware of the situation and the potential risks from their uniform coming into the home. Many of them were changing on site, but there wasn't necessarily the facilities for them. And some of them were changing on their doorsteps before they entered the home, which was a different behaviour to we were seeing from before the pandemic. So in the UK, parts of the US, the Republic of Ireland, nurses domestically wash their uniforms. Now, obviously that brings in behavioural differences and knowledge differences between the nurses. So around 47% were washing below the recommended 60-degree wash. However, during the pandemic, this significantly decreased. There was only around 17% that weren't necessarily following guidelines. But there's different issues that come into play as well. For instance, time. Do people use a rapid wash at 60, which we've shown doesn't actually reach temperature and doesn't necessarily decontaminate the textiles? What types of detergents are they using? In the load, is there other garments that the microorganisms may cross-infect? So that there's so many different parameters, and for instance, when the nurses are wearing their uniform and it's contaminated and they go into the car or the domestic environment, is there any transfer during that period? So when we talk about industrial laundering, that's very much monitored, and there's standards in place to ensure that those infection control procedures are in there. Yes, absolutely, because with bacteria we've shown that the bacteria are able to survive for longer, for up to 21 days on sort of a cotton fibre, whereas it's much shorter on a polyester fibre. So if we were talking about our Staphylococcus aureus or our E. coli's, then fibre choice we'd be saying should be more around the polyester type fibre, because we believe the moisture and the potential nutrients in the cotton fibre is allowing those bacteria to survive for longer. However, when we're talking about the coronavirus, what we've shown is actually the cotton fibres is a shorter survival time, because we believe that it's desiccating, so it's drying out the virus with the absorptions. And we saw something similar when we looked at leather. However, on polyester, where the coronavirus is sitting on the surface and not drying out, that it can actually survive for longer. So almost the microorganism you're talking about and how long it lasts depends on the type of fibre that you're looking at. So what needs to be established is a very absorbent, sort of man-made, smooth finished fibre that would allow for the reduction in survival time of both microorganisms. Healthcare textiles can carry microorganisms. However, if they're laundered properly, then they're completely safe. So realistically, we need to ensure that all healthcare textiles are laundered, maintained well, and ideally industrially laundered, because it takes out factors of behaviour that's from individuals, whereas if it goes through industrial laundering, then it is a guaranteed, monitored process. Healthcare textiles also can play a role in PPE as well, so different types of textiles can be used for PPE. So we looked at coronavirus on textiles, and our virologist, Maitreyi Shivkumar, had to set up a model for SARS-CoV-2, which is called OC43, and we had to ensure that this model behaved in the same manner as SARS-CoV-2. So once that model was set up, we could then start looking at the contamination of textiles and how to decontaminate them. And what the research showed was that coronavirus was able to survive on polyester fibres for up to 72 hours, whereas cotton was around 24, polycotton was 6 hours. We believe there was some antiviral potential finish on that polycotton that was just the normal finishing process. So we established that the coronavirus could last on textiles for a number of hours, if not days. We then looked at its potential to cross-contaminate, and we showed that it could cross-contaminate both onto hard surfaces like plastic, but other porous surfaces like textiles within that period of time as well. We then looked at its survival during the wash process. Now, in the wash process, we found that lower temperatures than we've seen with bacteria, so 40 degrees rather than the 60 degrees, was able to remove the virus from the textile. So whether that was in a domestic machine, an industrial machine, or an on-premises laundry, we demonstrated that it can be readily removed. So with coronavirus, the risk really comes in at the point between the ward and the washer, and that's where the potential risks are and cross-contamination risks are. Our research has shown that, as I mentioned, that healthcare textiles do carry microorganisms and that they can also transfer to other surfaces. In the case of coronavirus, we looked at plastic surfaces, we've looked at stainless steel surfaces from leathers, for instance, and for bacterial contamination, we've also shown transfer to other surfaces both before and during the wash. So they potentially have a role in transmission of microorganisms. However, to date, there's been no direct link made between a textile and a patient having an infection. That said, there is policies in hospitals that, like the above the elbow policy, that are there to ensure that the textiles are not in close contact with the patients.